Welcome back. Did you know that your body can adapt to stress at the cellular level? Whether it's from exercise, pregnancy, or even chronic diseases like hypertension, your cells have incredible ways of responding to the demands placed on them. Today, we are diving into how your cells grow, shrink, or change to keep you healthy. Let's dive into today's question. A 62-year-old man presents with shortness of breath, fatigue, and swelling in his legs. He has a history of long-standing hypertension and his blood pressure has been poorly controlled for years. On cardiac examination, there is an enlarged displaced point of the maximal impulse and a systolic murmur. An echocardiogram reveals thickening of the left ventricular wall. Which of the following cellular changes are most likely responsible for the enlargement of his cardiac myocytes? Focus on what the question is asking. Here, the fundamentals of cellular response to stress are being addressed. Let's look into the various types of cellular growth adaptations. Cellular adaptations are the mechanisms by which cells respond to changes in their environment. The major adaptations include hyperplasia, hypertrophy, atrophy, metaplasia, dysplasia, aplasia, hypoplasia. Each of these adaptations has different causes and pathologic implications. First up, we have hyperplasia. This is defined as an increase in the number of cells in an organ or tissue, often leading to organ enlargement. The mechanism behind this involves the activation of cell division or mitosis of stem cells and differentiated cells, typically due to growth factors or hormonal stimuli. It is composed of two types: physiologic hyperplasia, which is often hormone-driven in the breast during puberty or pregnancy, or it could be pathologic hyperplasia, for example, endometrial hyperplasia due to unopposed estrogen. It can predispose to cancer, for example, hyperplasia of the endometrium, but benign prostatic hyperplasia is an exception. Unlike neoplasia, this is a reversible process. Next, we have hypertrophy. Hypertrophy is an increase in the size of individual cells, resulting in an increase in the size of the organ or tissue. This occurs when the cells increase the production of structural components like organelles, including mitochondria, sarcoplasmic reticulum, and proteins like actin and myosin, along with DNA and RNA, leading to larger cell size. This is seen in permanent tissues, including cardiac muscle cells, skeletal muscle, and nerve. This often occurs in response to increased demand, for example, cardiac hypertrophy due to hypertension or exercise-induced skeletal muscle hypertrophy. Next, we have atrophy. This is defined as a decrease in the size of cells, tissues, or organs due to reduction in cell size and/or number. A decrease in the number is due to a process called apoptosis, which we will be discussing later. A decrease in the size is due to increase in the cytoskeleton degradation via ubiquitin proteasome pathway and the autophagy of cellular components by autophagic vacuoles. For example, a decrease in the workload leads to muscle atrophy after immobilization. There is a loss of innervation after neurogenic atrophy in polio or spinal cord injury. There is a reduced blood supply in the ischemic atrophy of the kidneys, like the atrophy of the endometrium postmenopausal. Nutritional deprivation leads to cachexia in cancer or malnutrition. Senile atrophy in aging leads to decrease in the organ size. Next, we have metaplasia. This is defined as the reversible replacement of one differentiated cell type with another. This occurs usually in response to chronic irritation or inflammation via reprogramming of stem cells. Examples include parotosophagus, where the squamous epithelium turns into columnar epithelium due to gastroesophageal reflux disease. Squamous metaplasia in the respiratory tract of smokers is also common. Here, the ciliated columnar epithelium may be replaced by stratified squamous epithelium. Vitamin A deficiency also causes metaplasia, called keratomalacia. Myositis ossificans is also another form of metaplasia which results in the formation of bone within the muscle post-trauma. Even though it is reversible, it may progress to dysplasia and eventually cancer. Exception is epicrine metaplasia of the breast. Next, we have dysplasia. This is defined as disordered growth of cells characterized by changes in cell size, shape, and organization, also called pleomorphism. There is a loss of cell polarity, nuclear changes, including increase in the nuclear cytoplasmic ratio and clumping of chromatin. Examples include cervical dysplasia, CIN, due to HPV infection, which can lead to cervical cancer. Parotosophagus can lead to esophageal adenocarcinoma, and osteogenesis imperfecta is also a kind of bone dysplasia. Next, we have aplasia. This is defined as a complete failure of development of an organ or tissue. The primordial tissue in this case is present. Aplasia can be congenital, for example, agenesis of the kidney, or acquired, for example, aplastic anemia due to bone marrow failure. Agenesis is due to a complete absence of the primordial tissue. Hyperplasia is an incomplete or underdevelopment of an organ or tissue resulting in smaller than normal organ. This can be congenital, for example, hypoplastic left heart syndrome, or streak ovaries in Turner syndrome. Coming back to today's question, here we can see a patient who has chronic hypertension and has signs and symptoms consistent with left ventricular hypertrophy. In response to the increased workload, elevated afterload due to uncontrolled high blood pressure, the cardiac myocytes adapt by increasing in size, which is called hypertrophy. There is an ultimate increase in the number of organelles, proteins, and the size of the cell without affecting their number. Feel free to go over the answer explanation. Here is the key point. I will be discussing general pathology further as well, so stay tuned. Don't forget to like, share, and subscribe. Thanks for watching.